Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is the time I get to spend with you guys and go over all your plastic surgery questions. And you know it's coming from a reliable source because I'm a double board certified, Ivy League educated, Duke trained plastic surgeon, all right? Doesn't get any better than that, okay? All right, good. So we're here at Pure Plastic Surgery today, and today we are going to talk about tips for success regarding your breast surgery, all right? So it's the last hump day of the month. Can you get it? You guys, yeah, we're a new month already, right? We're already Labor Day, already September. Summer's gone. What happened? I don't know. But yes, it is the last hump day for August, which means that it's going to be our last hump day here where we're focusing on the breast, okay? As you guys may have noticed now, moving forward, each month is going to have a little bit of a theme. So that's what I'm going to be talking about, during like the first few minutes of each hump day. And then of course, I'll be happy to answer any questions regarding any plastic surgery topic that you may have, okay? So what are some of the tips for success, all right? So of course, everything starts before surgery, before you actually show up to the clinic, to Pure Plastic Surgery, or wherever you're going to be going. And of course, the first thing you got to do is choose the right surgeon. Now, is there just like one global thing, right surgeon? No, it should actually say choose the right surgeon for you, right? Because not every surgeon patient kind of is the right fit. There may be different styles, maybe different things you're comfortable with, different locations, etc., etc. But you want to choose the right surgeon. I think some of the most important things that you have to look into, and this is definitely by no means an exhaustive list. If you want to see an exhaustive list, I've done like a full hump day on how to choose the right surgeon, and I recommend you go to our YouTube channel, Pure Plastic Surgery on YouTube, and you look for that hump day, and you're going to see like a whole presentation strictly on that, okay? But for today, of course, you want to go, safety, always a priority, always, 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 and not just the surgeon, but also the facility where the surgeon does this, the operations, okay? So safety is number one. You want to go to a surgeon where safety is the number one priority, and you want to go to a facility that has a certification that demonstrates that it's extremely safe, such as the Joint Commission or JCO, which is what we have here at Pure Plastic Surgery, all right? Board certification, but not just any board, right? What does it matter if a surgeon's board certified in pediatrics when what you're having done is a breast surgery, right? That makes no sense. What does it matter if a doctor is certified in psychiatry, but you're having a breast surgery, right? So it's not just board certification, it's board certification by the American Board of Plastic Surgery. That's what you have to look up, the American Board of Plastic Surgery, all right? And then of course your experience, right? You want to go to someone that has done plenty of breast procedures, okay? Or if you're in the clinic and they're a young guy, at least they're in a clinic where they do a lot of this and they have mentors that have done a lot of this, okay? And this is especially true when you're talking about the combination of a breast lift with implant. This is actually not an easy surgery, not that straightforward. It takes a lot of experience to get this right, okay? But of course, I've done hundreds, if not thousands, of these operations already, okay? So you're going to start there, choosing the right surgeon, and then once you've chosen the right surgeon, the right place, and you basically place your deposit and you have your date, well, now it's time to get prepared, right? And so pre-surgery, there's going to be several things that you have to do. These are some very important points here. One is for sure, you definitely want to make sure there's no nicotine in your system. Regardless of how you get nicotine in your system, it can be through smoking, through vapes. It can be through, like the gums, the patches, the this, the that. Doesn't matter. No nicotine in your system whatsoever for any reason, okay? Why is this so important? This is especially important if you're doing either a breast lift or a breast reduction. Because if you have nicotine in your system, it greatly increases the chance of decreased blood flow to the nipple area and then getting nipple necrosis, nipple death. Not good. You don't want your nipple to turn black and fall off. It is bad, okay? So if you're smoking and nicotine in the system, the risk of that is a lot higher, okay? Next one is your estrogens. No estrogen in the system in any way, shape, or form either, okay? You don't want estrogen in your system where it's a pill or the implantable device or any other way. No estrogen in your system because estrogens increase the risk of blood clots. Okay, once again, we're going back to this, right? Safety. So, no nicotine because you don't want nipple necrosis. No estrogens because you don't want blood clots, DVTs, clots in the legs, or PEs, clots in the lungs, which can be potentially fatal. So it's very serious, all right? And then, for those of you that are breastfeeding, it's very important for you to know that you should stop breastfeeding at least 6 months before your breast surgery. We want to give the breast ample time to close down all those ducts, all those milk ducts, before you have your breast surgery. Why is that? Because when we're doing breast surgery, obviously by definition, we're making incisions in the area of the breast. And if the ducts are open, not only is it messy because we actually see the milk kind of coming out, but it increases your risk of infection, right? Because the ducts are open, so there's essentially an open communication between the outside world and the inside of your breast. And that's why the risk of infection is higher. Have you heard of mastitis, right? Those of you that, have become pregnant and are breastfeeding, and then you get this infection in the breast called mastitis. Well, that's because now the ducts are open and bacteria gets into them, which causes an infection. Same thing can happen when you do surgery. So we need you to stop breastfeeding at least 6 months before your breast surgery to minimize that risk, okay? So we're minimizing the risk of nipple necrosis, we're minimizing the risk of blood clots, we're minimizing the risk of infection. All right, if we're able to do all this, actually the risk of breast surgery is extremely low, less than 1%, okay, of any of these things. But you have to do the right thing. You got to choose the right surgeon, you got to prepare. All right, now before surgery, within 45 days of surgery, we're going to make sure that you as a patient, as a person, are healthy to undergo general anesthesia and have a surgery. So we're going to ask for your labs, we're going to ask for your EKG, we're going to ask for your medical clearances, right? So make sure you get all of those in so that we can make sure that you're ready for your surgery. And there's a lot more details to that, but just know that everyone gets a call from a pre-op department 45 days before surgery to go over that entire checklist and make sure that you're getting everything done on time so that you don't lose your surgery date. This is extremely important. There's a reason why we call you anywhere between 45 to 60 days before surgery so that we can give you ample time to get ready. So please don't procrastinate. Don't put off those labs until you're only 1 or 2 weeks before surgery. Okay, we ask all of our patients to have your labs in at least 3 weeks before surgery. And that doesn't mean your lab appointment. That means your lab results. So we need you to have your lab results 3 weeks before surgery. That way, if there's an issue, we can fix it and we don't have to change your surgery date. Okay? If everything's perfect, great, nothing to do. But say, there's a problem and we need to get a further clearance or we need to give you some more iron supplementation. Well, if we have 3 weeks, we can get it fixed, we can get it done, and you can still have your surgery and not postpone anything, all right? But if it's too close to surgery date, then we gotta cancel your surgery and postpone, okay? So, very, very important there in the pre-op part of it. And the next is, of course, your expectations. You have to have an idea of what it is that you're looking for. So, and then you have to be able to describe that. Try to talk to your surgeon, describe what's the look that you want. If you want to bring some wish pics, that's okay too. That helps us, create a plan to then choose the best surgery and the best implant for you, right? We're going to be choosing implants. We're going to be choosing whether you need a lift or not, what type of a lift, etc. And that's going to depend on your expectations and what you're looking for, okay? At the same time, please be aware that, for example, implants and what size implants that we can use is going to depend a lot on your specific body structure and measurements. So that's what we call smart aesthetics. That's where we kind of combine your objective measurements with your desired outcomes and my experience, and we put all of that together to create the best plan for you, a plan that's going to create, beautiful, long-lasting results, okay? So just say, for example, because you come in and you say, Doc, I want 800 cc's implants, and your body only has a base width of 12 centimeters, that's not going to work, right? It just physically doesn't fit your body. So we got to put all those things together to create the best plan for you, okay? And the last thing regarding expectations is, of course, they have to be realistic, right? We want you to have realistic expectations. It is my job also to make sure that I explain to you what can be done realistically, right? Versus something that just won't fit your body, something that can't be done or can't be achieved, especially in the first or one, surgery or one round, okay? All right, good. So now we've done all that. And then it's surgery day. I didn't even put it up here because that's my job, right? I'm in charge of surgery day, so I got to make sure that you're doing well, you're being safe, and that we're doing the surgery. Okay, so that's my job. But then comes the post-op. Now it's back to you. Okay, so post-op, you have to take care of yourself. Like I always say, the post-op care is just as important as the surgery itself. I've seen many a beautiful surgery be ruined by poor post-op care. Okay? And I can have this beautiful on-table result, everything went perfectly, and then something happens in post-op and everything is ruined. Okay? We don't want that. So the post-op care is just as important as the surgery itself. You gotta make sure that you're wearing the appropriate garments. We do give you a surgical bra. You're gonna wear that for the first week. After that, we recommend the sports bra. Sports bra has to open and close in the front, and it cannot have underwires. Okay? So that's going to be the garments. Definitely no heavy lifting or strenuous activity, okay, for the first 6 weeks. Even if you're feeling great at 2 weeks, don't do it, okay? I have seen a good amount of bleeding or hematomas, late hematomas, after 2 weeks or after, because the patient feels like they feel great, they have no pain, and they start doing a lot of activity, and then boom, you get a hematoma, and then that's a big problem. We have to go back to the OR, we have to evacuate the hematoma, sometimes we gotta remove the implant, it's a mess, okay? So remember, no strenuous activity, no heavy lifting for the first 6 weeks, and no submerging the body, or especially the breast or chest area, underwater for the first 6 weeks. So no pool, ocean, jacuzzi, bath, nothing like that for 6 weeks. Again, I've seen plenty of beautiful results get ruined by submerging in the pool, the wound opens, the implant gets infected, and then we have a big problem. Okay? All right. And then last but not least, plus minus massage. I say plus minus because I don't do it routinely for all patients, but it is possible that as we go along in your recovery, I feel like maybe one implant's not settling as quickly as the other, or I want them both to settle just a little bit quicker or help them along. And so we'll institute some breast massage, and of course we'll show you how to do that if and when the time comes. Okay? Remember, at the beginning, the implants are going to look way too high. They're going to feel tight. The bottom of the breast is going to feel a little bit empty, and it's going to look a little squarish. And that's normal. That's okay at the beginning. And then it takes 3 months for the implants to settle. And then that's going to fill out and round out the bottom of the breast. But it's going to be a slow, gradual process. Okay? All right. And then last but not least, I just want to mention the complications so you know what to look for. Because if you see anything, then you got to let us know. Because the earlier we get on top of a complication, then the easier it's going to be to take care of. Okay? And the later we know about a complication, well, the more problematic that's going to be, potentially leading to a loss of tissue or a loss of implant or reoperation. Okay? So of course, bleeding is one. It's pretty rare with the breast, but it can happen. The first thing you may notice is that one breast, you're doing okay. You're doing okay, all of a sudden, like it's almost like instant. One breast just blows up. It gets huge and it starts to get tight and tense and it hurts. That's what we call a hematoma, typically due to bleeding. So if that happens, you gotta alert us immediately so that we can then probably the next day take you back to the operating room, evacuate the hematoma, look for the bleeder, and stop the bleeding. Okay? If we know about this quickly, then we can most of the time, put the implant back in and just clean everything out, put the implant back in, and then you're good to go. All right? Infection, of course, is something that is always potentially a risk. Like I said, with most breast surgeries, it's very low. Typically less than 1%, 1% or less, okay? But it can happen. So if you see, purulent, thick drainage, if you see redness around the incisions, those are things you want to look out for. You want to tell us immediately so we can start doing antibiotics or provide any other solutions to fight off the infection, okay? Wounds, What's not uncommon, so it can happen, maybe about 20% of the time, is that little wound at that T-point if you're having that anchor type breast lift or breast reduction. So that's not too unusual. It's where that vertical and horizontal scar meet, right around here. And sometimes they can open up like a centimeter or two. Typically, we just treat it with some antibiotic ointments and dressing changes, and it heals on its own. So it's not a big deal, but you do want to let us know so we can guide you through how to take care of it. Okay? Nipple necrosis, right? What do we say was the number one potential cause of nipple necrosis? You guys remember? Wasn't that long ago.
Let's give them time. Yes, Doc. Yeah. It's a little delay.
A little delay? Okay.
Yeah.
All right. Well, there's something that's very related to nipple necrosis, which obviously we just talked about. And then, of course, another thing that's related to it is what I said before, the surgeon experience, right? Especially when you're combining that lift with the implant, you want to go to a surgeon who has a lot of experience because they're able to do things in a way where the chance of nipple necrosis is very, very low. Never zero, but very, very low. If you go to a surgeon who doesn't have a lot of experience, the chance of nipple necrosis is higher. Yes.
One answer.
One answer? What is it?
Nicotine.
Yeah, there we go.
Yeah.
All right. You get a prize. Starbucks for you.
Free?
All right. Good. That's right. So one of the things that may lead to nipple necrosis is that nicotine. So the nicotine is positive. Chances of nipple necrosis go way up. Okay? And then always anytime we use an implant, there's always a risk of what's called capsular contracture. That's when the wall around the implant becomes hardened or thickened. Sometimes it can get really tight around the implant and distort the implant, cause some tightness and pain. That's capsular contracture. We always want to keep an eye out for that because once again, if we get it early, then sometimes we can just treat it with massage and a medication called Singular. And that takes care of the capsular contracture. However, if we get it late, like a grade 3 or grade 4 capsular contracture, or it's been over a year since your surgery, then most of the time, then the solution is surgical. That means we got to go back to the operating room. We got to remove that capsule entirely or almost entirely and exchange the implant. Okay? So it's another thing to kind of keep an eye out for there. All right? All right, so I think that was a lot of information, but these are some very, very good tips that you can use in order to, minimize risk, minimize complications, and ensure a successful outcome for your breast surgery. Okay? But I'm happy to answer any questions regarding this or anything else.
You want a seat?
What's that?
Take the seat.
Take the seat?
Yeah, because a lot of questions.
No. Let's go for it.
Okay.
Let's go for it.
Let's go for it. Okay, start asking about Galaflex.
Oh, yes.
Do you do Galaflex? I already had a lift and an implant, but I want a fuller upper pole. I want to do an exchange to a higher CC implant.
Great, so that's a great question. So first of all, just to answer the first question, do I use Galaflex? Yes, I use Galaflex. Do I use it for all patients? No. I typically don't use it for a primary case. So primary case means the first time you're ever having a breast surgery, which is not your case. You've had a breast surgery, but now you're going for a little bit more of a fuller look, especially in the upper pole. So in that case, yeah, I typically do recommend usually a combination of 3 things. Exchanging the implant, redoing or tightening up the lift, and adding that internal bra with the Galaflex mesh. All right. So yes, when we do all those 3 things, we can then typically get that much more like kind of that push-up look with more fullness in the upper pole. But like I said, I don't use Galaflex for primary cases because it's typically not needed.
Okay. How does work for a woman with hormone replacement treatment pellets insert? I guess that for the pre-surgery.
Right. So again, we want to try to avoid estrogens in any way, shape, or form because it can increase your risk for blood clots. Okay. Now, if it's used in a way where it's just strict hormone replacement, meaning that if you don't have the pellets, you're like way below normal levels of estrogen, and so the pellets are just getting you to what's called a normal physiologic level of estrogen, then that potentially can be okay. But of course, that's going to require some more, investigation. Basically, we would send some labs. We would see what your estrogen levels are. We would make sure that they're normal within physiologic limits, that they're not overly being done. We would get, of course, the medical clearance as well. And so if everything kind of starts to pan out, then we can consider the surgery.
Okay.
But, yeah.
Sorry. What about an IUD birth control? I'm still able to do surgery?
Right, so IUDs are typically okay because most IUDs, they either have no hormones, or if they do have hormones, they have progesterone. Okay, most IUDs that have hormones are progesterone only, which is fine. Progesterone and estrogen are not the same thing. Okay, estrogen increases risk of blood clots, progesterone does not. So if you have a device, an IUD, or implantable device that only secretes the progesterone, then we're okay with that.
Okay. Do you still offer chin lipo with face tight?
Yeah, of course. So typically, whenever you're gonna do face tight, it's that combination. It's so you're gonna do the lipo and the face tight, and that's a very common combination that we use for the chin area. So we'll combine the chin surgery with the face tight. I rarely now do chin lipo on its own, meaning most of the times if I'm doing chin lipo, I'm adding the face tight, because the face tight really helps that skin retract, so you can get that nicer, sharper angle, and not get this, not have the skin become loose after your liposuction.
Okay. My last consult told me they would be doing shots to prevent blood clots.
Mm-hmm.
Is that possible?
Yeah, it is possible, and so every surgeon is a little bit different in terms of how aggressive they are with the shots. The most common shot is called Lovenox, which is an anticoagulant, and so that is certainly something that can be done, but it's, typically it's done for patients that are at higher risk for blood clots, right? So there may be certain genetic disorders or a higher BMI or things of that nature. Okay. I sometimes use them as well if I have a patient that maybe has a family history, even though they don't have a personal history of blood clots, or maybe their BMI is a little bit on the higher side, or I think the surgery is going to go a little bit longer. But I don't use it routinely for all patients. Most of my patients are very healthy. They're under 50, their BMI is under 30, and I keep my surgeries typically under 3 to 3.5 hours. For those patients, you typically don't need the Lovenox shots.
Okay. Hello, Dr. Earle. I had surgery in 2019 with you.
All right.
I'm very happy with my results. I would like to know if you can remove my breast silicone implants and reconstruct my breast with my own fat from a liposuction.
Okay, well, first of all, thanks for coming back here. It's lovely to hear from you, especially patients back from 2019. That's awesome. And so to answer the question, yes, it is possible to remove implants, and usually when you do that, at the very least, you're gonna have to do a lift, right? So for the most part, you can remove the breast implant, and then do a breast lift. And we'll take whatever tissue you have to kind of reorganize it, give you a little bit more fullness in the upper pole, and lift up and tighten up the breast, okay? Now this is going to depend a lot on, what the breasts look like right now, like if there's any volume there that we can use for that lift. So in order to really know what the plan would be, I would have to do an evaluation, look at the photos, and determine what would be the best course of action, okay? Now, can you do also some fat transfer at that time? It's possible to a limited extent. You can't really do too much fat transfer at that time, because you have to have the space for the fat to go in there and live and survive and not run the risk of fat necrosis or fatty cysts or oil cysts. Okay, so can you do some fat transfer? It's possible, but it's probably going to be very limited.
Can you do face tight if you had a chin lipo 6 months ago?
Okay, so you can do face tight after chin lipo. I would want to wait at least 9 months though. So you want to wait at least 9 months so that everything kind of completely softens up in the area. And then yes, you can come back and do face tight.
Currently breastfeeding, do I need to stop 6 months before a BBL and lipo 360 as well?
So the key, it's okay. So if you're gonna have a breast surgery, then you have to stop the breastfeeding 6 months before. Now, if you're gonna have a surgery that's not related to the breast, then usually I would like to stop at least 3 months before. And that's not necessarily because of the reason that I said here. The reason I said here, right, was remember it's because we're cutting, making incisions in the breast, and we're increasing the risk of infection in the breast. The reason for stopping the breastfeeding at least 3 months before a non-breast surgery is to make sure that the body kind of bounces back to baseline, right? Because when you're breastfeeding actually uses up a lot of calories. And you're probably still like in that losing kind of weight curve, or maybe you lost weight and you stop breastfeeding, you may gain a little bit of weight. So I want to make sure that you're kind of at a baseline where you're not having a lot of fluctuations before you then go and do your BBL or tummy tuck after you stop the breastfeeding.
Okay. How soon can someone get breast surgery after a BBL?
Great question, because I typically don't combine this procedure, so I love this question. And yes, I do them separately, and you want to separate them out by 3 to 4 months. So you can do your BBL, and then 3 months later, you can do your breast surgery. And that's going to be the safest way, not only the safest way, but the one where you're going to have the best long-term outcomes.
Is it advisable to do a BBL and breast augmentation in one visit? If no, what order do you recommend?
All right, so that follows up this question. So I don't like to combine those. Not only do I don't like to combine it, but here in Florida, you really shouldn't, and if you want the best results from each, unless you're like a fairly low BMI patient. When here in Florida, you are limited as to how much fat you can remove via liposuction when you add another surgery, such as a breast aug or breast surgery. And so you're limited to only 1 liter of fat being removed by liposuction when you add the other surgery, which is not a lot of fat to remove and not a lot of fat to transfer. So you're not going to get a great BBL. And then of course recovery becomes tough because with the BBL you should be face down, but with the breast surgery of course you can't be face down, so then you're going to be compromising your BBL results. So not only are you not getting the fat removed that you want or the fat placed that you want, but now you're on top of that compromising that result because you have to be sitting or on your back for recovery, even if you do like those cutouts and other things, okay? So long story short, I recommend separating out the procedures so you can have the best result from each. And you can, if it's a breast and BBL, you can do them either way, whatever you want to do first. And you separate them out by 3 months, okay? Now, if it's say a tummy tuck BBL, again, I recommend separating out the surgeries or staging the surgeries, and I always recommend doing your tummy tuck first, okay?
I had a BBL 3 years ago with you. Can I start back compression with fajas?
Can you start now? Yeah, sure, no problem. You can start the faja again. You can stop whenever you want. There's really no restrictions there. Some people wear fajas long term. Some people absolutely hate it and they stop after the first 3 months. But it's not unusual. I've seen people wear their faja at least 12 hours a day after BBL long term, and no problems.
Okay, and the last for this topic, how about a tummy tuck, breast augmentation, and liposuction?
So you can do a tummy tuck, breast augmentation, and liposuction to the flanks and the waist. That's a very common procedure. That's what we call our mommy makeover. And why only the flanks and the waist? Well, like I just mentioned, right? You can only remove 1,000 cc's. In most patients, you have about 1,000 cc's in the flank and the waist, but then we don't have enough to go around and lipo other areas, right? So yes, mommy makeover, very, very common. We'll combine your tummy tuck, which means we're going to remove the excess skin. We're going to do your muscle repair, and we're going to do the lipo to the flanks and the waist, removing up to 1 liter of supernatant fat. And then whatever breast procedure you need. Breast augmentation is fine, but it can be a breast lift, breast reduction, or a breast lift with implant.
Doc?
All right?
Yes?
Okay, awesome. Well, I think that was great. We got a lot of great tips here for successful breast surgery, but we have a few, I was going to say we have one and no, we have many announcements here today, all right? So
yeah.
I'm going to see, because Willie there, he's testing me. I'm going to see if I can remember them all right?
Okay.
So let's start. So numero uno, this week, I don't know if you got it, but this week was our flash sale. which means that if you book any breast procedure this week, you get your implants, your breast implants for free. Free breast implants. Who doesn't want that? Free breast implants, okay? So you have, I mean, it's already Wednesday. It's all, week's almost gone. You got till Friday. And then after Friday, boom, that's it. Those free breast implants, they're all gone, okay? All right. That was number one.
Yes.
Number two. Yes, that's right. We're gonna have a special event also next week. Next week on Thursday. It's called Colas Encoladas. All right, you gotta do the little Colas Encoladas. All right, what does that mean? In English, like for those that need a translation, it means buttock and coffee. All right, Colas Encoladas. Why? Because it's an event that we're going to be talking about cellulite. All right, it's going to be we're going to be talking about cellulite and the number one and only treatment that works for cellulite, which is called Avali. All right, we are platinum partners with Avali. We're the number one cellulite treatment clinic in the entire East Coast. All right, we're the platinum partners with Avali, number one cellulite clinic in the entire East Coast. That's us. And we're going to have a special event this Thursday. We're going to be giving away a bunch of free stuff. All right. So
money.
Yes, including money and money off procedure. So make sure you're looking at all our channels. All right. My Instagram, Dr. Vidal's Instagram, Dr. Wigriff, Pure Plastic Surgery. All right. Make sure you hop on there because you're gonna get all the details regarding the colas and coladas for next week. I like cellulite treatment there. All right. And last but definitely not least, do you guys remember the little teasers that we were sending like a few weeks ago? Like something big is happening, something special, right?
New horizons are coming.
Yes. Well, it is finally here. I'm not gonna give it away completely, but it's happening tonight. So what I want you guys to do is tomorrow log on to our website, okay? Go ahead and log on to our website for a big surprise. And I especially want you to go through the website, but I especially want you to go through our before and after gallery. It's gonna blow you away. All right. So yes, make sure you do that. All right. Okay, everybody, and that's gonna wrap it up for today.
Yes, sir.
All right. And I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. All right. Have a great Labor Day weekend, and we'll see you then. Take care. Ciao.
What's the website?
What's the website?
Yeah, you didn't say Pure Plastic Surgery. And you're asking.
Right, okay, it's www.pureplasticsurgery.com. Okay, www.pureplasticsurgery.com. All right, everybody. We'll see you then. Take care. Ciao.